I offer Invisalign treatment to my patients for a number of reasons. Firstly, and most importantly, it's a much more aesthetic way of having your teeth aligned than traditional braces. Patients love the idea that they are virtually invisible. Next to nobody will know you're wearing them, and as if that wasn't enough, they're really good for oral hygiene. People take their aligners out to clean their teeth and there's no issues with getting the floss in. Being able to clean in between the teeth is much simpler than it is with braces. Also, there are some clinical situations where the Invisalign treatment is at least as good, if not a little bit better, than braces, and particularly this is for people who have only a mild amount of crowding and teeth that don't overlap very much. The aligners are really good at increasing this overbite. And lastly, people are asking for Invisalign treatment. A lot of people know someone who's had it and they've been very impressed with it, and it really is just selling itself.
So using Invisalign was really easy. It was just they're taking them out for meals and keeping them clean, which is pretty straightforward. And it sort of removed the awkwardness that you have with braces of getting food caught in them and everything that goes along with that.
People sometimes ask me, are there any limitations to who can be treated with Invisalign aligners? Aside from the obvious that people need to be super motivated to wear them 24 hours a day, keep them in their purse with them when they're not wearing them, take them out when they're eating, put them back in again, things like that. Aside from this, there are some clinical situations that are less suitable, and I guess this is typically people who have a really severe malocclusion, teeth that are really crowded, or particularly those where surgery is going to be required to move the jaws around. This would make them less suitable for treatment with Invisalign, and some cases where the treatment is going to be particularly complex, it may be more straightforward or more practical and certainly easier to get a good result with ordinary braces. And I guess people who have impacted teeth where you're bringing a tooth into the line of the arch, this is probably less suitable for aligners and more suitable for traditional braces. But an awful lot of cases can be treated with Invisalign aligners that people might not have thought they were candidates for.
From an appearance point of view, they were exactly as expected, really easy. They weren't usually visible for most people, which was a big thing for me. From a professional point of view, I was a bit worried to look like a young teenager, and my job is sort of generally deal with older people, so having that level of immaturity by perception was a major reason that I chose Invisalign over traditional braces. From a disadvantage point of view, I can't really think of anything that was a negative. You got used to taking them out. That was, to start with, you had to remember to take them out for meals, and occasionally when you were eating out at restaurants you had to sort of prepare. But day to day it was really easy, no issues at all.
Dean was a very suitable patient for using Invisalign treatment, partly because he was absolutely determined to avoid braces himself. He had a position in the public eye and he really wanted to avoid the appearance of the braces to his clients, and as a result of this he was super motivated to do everything we asked. He wore his aligners perfectly and couldn't have done more. He also had a very suitable set of teeth for aligning with Invisalign. They had a relatively shallow overbite, not too crowded, no extractions required, and this was just the ideal combination.
I guess the one thing to consider is that you really do have to be focused on the final result. I know that I always wore my aligners, with the exception of meals, and there was never a day where I sort of was slack and forgot to do it. So that's something that you do want to consider, that I don't think you would have as an effective final result if you weren't committed to it. So you left them out for a couple of days on end, or you were a little bit lazy about putting them in before going to bed on certain evenings. So that's probably the one thing I would sort of caution people to be aware of.